and also Professor Watanaki from Japan. I don't know what time is it in Japan, maybe in the morning or maybe it's the same afternoon, but a little bit different with Indonesian time. So today we will have a guest lecture from Japan regarding the what is the older people care in Japan on some other issue related to elderly care in the country of Japan. So the student, let me brief a little bit about the students that we will have around maybe maximum, is it 175 students. They are all the undergraduate students. They are now taking what is gerontologic nursing course. So this guest lectures is very important for them to learn about good practice of healthcare system and also elderly what the services in such developed countries such Japan. So in this occasion, we will have two speakers, Professor Kyoko Sudo and also Professor Shigeki Watanuki. I'm sorry for I have to read the names. All the speakers, Ibu Citra, should I also maybe you just can okay, what's present or shows the curriculum vitae of the distinguished professor. So these are all the CVs. I may not read all the CVs. Maybe we can see here lots of experience in related to elderly and aged care in Japan. So I hope all the students can gain so much benefit from today's lectures. So actually we will have a panel session of the presentation from the distinguished professor. Maybe Professor Sudo will speak for the first one. Professor Sudo will speak for about 30 minutes, and then will be followed by Professor Watanuki for another 30 minutes. And then after two presentations, we will have a discussion from the students, and also we will have some a little bit conclusion at the end of the lecture. So roughly we will have around maybe 1.5 hours for these lectures. So without further ado, I will give the session for the first 30 minutes for Professor Sudo. Thank you very much. Do you need to share your screen, the screen? Okay.
Okay, I will share the screen by myself. Is okay?
Is there already dark outside in your country? In this.
Sorry, I will share the screen, the slide.
Oh, okay.
From my side, is okay?
Yes. Yeah.
Okay. Okay, wait a moment. Can you see the slide now?
Yes, we can see the slide. Yeah.
須藤先生、多分発表者ツールで見えてるけど、まあ、いいですかね。発表原稿が右側に。まあ。
ちょっと待ってね。ちょっと待って。チェンジしますね。
スライドショー共有ですか？
いや、これどうやってやったらいいんですか？先にスライドショー。これで OK？
今 OK ですか？
That's right. That's already.
全画面。
slide
全画面になりました。
はいはい。
あ、
はい
OK, OK. It's okay, no? Okay.
Yeah, yeah.
So, can I start now or
Yes, please.
Okay. Okay. My name is Kyoko Sudo. Then I'm working for National Center for Global Health and Medicine Bureau of International Cooperation. So now my topic is health policy and service delivery, including home care. So there's some of you, your colleagues, maybe they're very interested in the home care, in Japanese case. So I will give some introduction of the home care. So mainly I will talk about the health policy for the elderly. So thank you very much for inviting me today. So I'm not sure that all of students knows our project. They're working with Chitora Sensei in UNPAD, your university. So we are conducting proceeding the project enhancement of educational skills of gerontic nursing in Indonesian basic nursing education. So this is under the project for global extension of medical technologies. So that one is managed by our bureau. So I'm also the organizing this project with Professor Watanuki. So this project has initiated since 2020. So then this year is the last final year of the project, and I'd like to share the findings of this project with you and maybe later, because Japanese academic year will be finished in March. So we are planning the one webinar with all Indonesian instructor and nurse preceptor. So maybe you can get some information from this webinar regarding the result of this project. So maybe I can start. The first one is the background of the elderly situation. I'd like to share you the aging situation. No? So this is information that many of you already familiar with. So the graph shows the aging rate from 1950 to 2060. No? So the aging rate is shown as a percentage of the population aged 65 years and above in total population. So the left side, the Japan, Europe, in the US situation, and the right side, including the Asian, Southeast Asian country. Japan is shown in red color, and the aging rate in Japan in 2020 is 28.6, the red one, so which is very high compared with other countries. So now we called such this situation like a super aged society. So comparing the left and the right graph, we can see that the aging will increase rapidly from 2020 in Southeast Asian countries. So the aging rate of Indonesia is on 6.5 now, 6.3 in 2020. So however, by 2050, it will exceed 14% and become an aging society. So this is a population pyramid in Japan and Indonesia. So in 1950, the left side. So 1950 in Japan. So we had a beautiful pyramid shape. So it means the large number of younger population and a small number of elderly. So Indonesia also has now the shape is changed. Now in 2020, Japan has like a bell-shaped bell. So the Indonesia, it is Japan's one is like a pen. So the Indonesia in 2020 like a bell. So as you can see, the right side 2050 in Indonesian situation, maybe there will be the similar shape like Japan. So that's why the Indonesian government and also you consider about the many issues with aging society. No? So a society with an aging rate of 7% is called aging society. And the number of years it takes to double that rate to 14% is called doubling year. So the last line, the France has had an aging rate of 77% since 1860s. But it takes 220 years to reach to 14% of aging rate in 1990, I think. So as you can see, the red band at the top, it took only 24 years for Japan to double its aging rate from 7% to 14%. So by the year 2000, the high-income countries such as Korea, South Korea, and Singapore in Asia had doubled over the same period, the 18 years and 70 years. And also in the figure in Thailand, there is, it is not showing here, but Thailand, Vietnam, now they have a high aging rate, also have shorter doubling years than Japan. So it means the rapid and drastic change in population structure require health reform to secure healthcare services and financial resources. So that means the definitely affect to the health expenditure for the country. So this just shows the aging rate and spending on healthcare, health expenditure as a percentage of GDP. So there is a positive correlation between the higher the aging rate, the higher the expenditure on health. So in other words, the aging population costs more money from this evidence. So let us look at about Japan's health policy for the elderly. So as you know, Japan has a universal health insurance system. There are two types of health insurance: employees health insurance and the national health insurance. Yes, and all citizens, all people living in Japan are enrolled in one of the two health insurance programs. So this, because of this universal health insurance system, people in Japan have free access to medical care at any time, and with co-payment ranges 10% to 30%. That normally for the working age, they should pay 30% of the medical fee. So this universal health coverage achieved in 1961. At that time, rapid economic growth, and there not so many, we don't have many aging population. So then 1970s, aging rate reached to 7%. And the burden of medical cost on the government increased. After that, 1990s, social hospitalization, that one is no need to stay at the hospital, but no way to return back to the home. That one is the social, at that time, we have such kind of social problem. So then in 2000, a long-term care insurance system separating medical care and welfare services was initiated. So the long-term care insurance is compulsory for those over 40 years of age. So then now in Japan, the system of providing medical and nursing care at the home has advanced dramatically since the implementation of this long-term care insurance system. Now in 2012, we started a community-based integrated care system. So that aim to live for elderly in the community. So that one is the brief explanation of long-term care insurance system. So this is somehow complicated, but we joined the long-term care system, insurance system at the age of 40, as I mentioned already. So those aged 65 and over can receive the service anytime they are certified as needing long-term care by the municipal government. So the elderly need the certification to use this insurance system. So this certification, there are two levels. The 1 to 2. 1 to 2 for those who need long-term care, and 1 to 5 for those who need support. So that one is we have one system to certificate that this level of the support or the nursing care need. So this is a community-based integrated care system. Wait a moment. Sorry. Sorry. So that one is also somehow complicated, very busy slide. But this system, the community-based integrated care center is established in each municipality to consolidate the information on the elderly living in the community and provide services suited to the health and the living condition of each elderly person. And also we have the chief care manager. That one is like a coordinator of the entire system. The public health nurse or social health care workers provide comprehensive service as a team. So the one coordinator will be in charge of this one elderly, each elderly. So as you can see, that one is the number of the healthcare facility for the elderly. As you can see, the number of the capacity of health facility is increasing. So the can see okay, maybe I can skip this one. Just I want to say that the healthcare facility for elderly is increasing in Japan now. Okay. So that one is the many causes for long-term care. Why they need, the elderly needs the long-term care. The dementia, that one is yellow-green, showing in yellow-green was the most common cause of the elderly needing nursing care at 18, in total 18.7%. So then cerebrovascular diseases, including stroke, they're showing in pink, 15.1%. So that one is almost half of the cause of the needs, main causes for long-term care. Yeah, as you can see that one, yeah, many of the non-communicable diseases, dementia, and also the bone fracture, such kind of bone and joint diseases, it is the affect a lot to mobilization, no? So that one is the cause of the, should be a cause of long-term care. So as I mentioned earlier about long-term care certification, the level of the care required is divided into 1 to 2 for support and long-term care. So it is maybe I need more explanation about this, but we have 2 types. So the graph on the right right side, it is compares the need for support and the need for long-term care by age group. The orange indicate support needed and blue indicate nursing care needed. You can see that those ages 75 75 years and over are needed more long-term care. So the needed more support. So this chart shows the time required for caregiving by family member and others who provide care at home. To how long time they spend for the elderly care at home by family. So the time required for care increase as the level of care increase. So as I mentioned that, I should translate into English. So that one is the long-term care level 5. So 56.7% of the family member taking care for the elderly almost whole day. More than half of the family. So it means the we spend a lot of time for the long-term care at the home by the family, no? So then I will talk about the home care service delivery, which is contributing a lot to living in the community. So I have already mentioned about the duration time spent for the elderly care at home. It is very the severe burden for the elderly care, but the majority of the elderly want to back to the home, and also the government side want to reduce the health cost in the institutional care. So when the elderly is discharged from a large hospital, he or she may return home or enter a nursing home. In both cases, the hospital and the local government work together to prepare for the elderly's daily living support. On the local government side, the community-based integrated support center is in charge. A care manager, chief care manager, is assigned to each elderly. So they then prepare for the services necessary for their life after discharge from the hospital. So there are various types of long-term care facilities, and some of them provide services such as rehabilitation on a day basis, the care basis, and others come to the home for the rehabilitation. And also we have the short stay, so like respite care for the elderly, the family also. So that one is a brief introduction of the type of home care. So there are various types of home care, including home nursing, home care, home rehabilitation, home guidance by pharmacist. Pharmacists come to a house to instruct how to take medicine, or if some elderly need to one package to take a medicine one time, so the pharmacist can consult with the doctor to order like this, their need basis. So, and also the home medical care and home dental care also we have. So yeah, there is no age limit for medical insurance, and some at home can be covered by long-term care insurance also be covered. The next one, here is the actual situation, some pictures. So the picture above shows the doctor visiting a patient at the home to provide medical care. So I think this one or this one is a medical doctor. He is medical doctor, I think. And then in most of cases, nurses accompanies them together and they observe their health. So on the right side is a view of the reception. What is that? Recreation and rehabilitation at the health facility for the elderly. Sorry, somebody. Okay. So as you can see below, the transportation service here for the elderly, it is very comfortable for the elderly using the wheelchair. So safety and convenience to use the health facility. So this diagram shows a hospital discharge support. So now we still have the barrier, but gradually we improve this system. The discharge from the hospital to the community, to the hospital side also have the one department to organize the care in the community after discharge. So based on the information gathered by the hospital nurses in this above, they first determine whether or not support is needed after the patient is discharged from the hospital. So for example, this patient, elderly person, live alone. So nobody living beside their house. So he or her house. So then, but this elderly need continuous care with medical treatment or something. So that time, based on the situation and the family support, amount of family support or the decision of patient and also their family. So based on these kind of information, we discuss about the elderly and their family. So what do you want to do after the discharge? Then if support is needed, the hospital nurse will consult with all parties, all stakeholders concerned, and make a plan with the patient and family regarding discharge support. So if nursing care is required, we will contact with the regional community-based integrated care center before the discharge. Normally, this care manager will come to the hospital to discuss about the situation, and also the support to decide the most comfortable the support for the elderly and their family. So the ward nurse will provide the necessary information for medical care and living, and prepare in the cooperation with the care manager and the hospital's discharge support office. So then home medical care in Japan has progressed rapidly since I already talked about the long-term care insurance. So since start this insurance system. In addition, it pays to reduce the number of days spent in the hospital and medical care cost. So they also now we are focusing on the prevention and health promotion in the community before suffering the diseases. It is the most important now to implement to achieve the UHC in Japan. So maybe it is one the recommendation we want to learn from you. I think in Indonesia you still have the power of mutual aid in the community and community engagement, community coherence. That one is the most important to achieve UHC in universal health coverage in Japan now. So that one is your the very facilitate factors now affecting the aging society. So that we should learn from you or other Asian countries. So maybe this one is the last slide. So, okay, thank you so much to terima kasih.
Okay, thank you very much, Professor Sudo, for the very interesting and integrated explanation about how integrated healthcare system and integrated healthcare system for all the person in Japan. So maybe the students, if you have some question for Professor Sudo, you may just write down first in the chat box and in your paper-based notebook, and then you can directly ask to Professor Sudo after Professor Watanuki present his presentation. Now, the second presentation will be from Professor Watanuki. Professor, you have 30 minutes for your presentation. Thank you very much.
Okay, should I start or should we wait for the questions for the first part?
No, I think we will do in a panel after your presentation.
Okay, sure.
Is that okay for you?
Okay, sure.
All right.
Okay.
Thank you.
Thank you.
Yeah.
Okay. So here's my slide. Okay, thank you so much for inviting us. So I'm going to talk about the genetic nursing education in Japan and overview of genetic nursing curriculum at the National College of Nursing in Japan. Yes. So, let's see. So here is 4 seasons, beautiful pictures from our college. In the spring, we have cherry blossom here. Okay, let's see, mouse portrait here. Okay. And on the right side, above side, we have a beautiful green summer, and the lower left, now we are in the fall. So the leaves are changing in brown or yellow or red. Leaves are falling nowadays. And sometimes on the lower right, we have snow in January, February. Sometimes snow accumulates like several centimeters here in Tokyo. Yeah. Okay, now let's see. Let's see. So here's pictures from the NCGM, is the National Center for Global Health and Medicine, and the pseudo-sensei is from the Bureau of International Health Cooperation. And we have a Center Hospital and the Konodai Hospital, 2 hospitals in Tokyo and Chiba, next prefecture. And the upper left research institute is, we have a research institute, and the lower right, lower left, we have a college of nursing, and in the suburb of Tokyo. So I'm from the College of Nursing. And here is a brief overview of our college, established by the Ministry of Health and Labor and Welfare in 2001. And we provide a bachelor's, master's, doctor program in nursing. And we also provide continuing education for nurses from national centers for advanced and special medical care, National Health Hospital Organization, and Hansen's Disease Sanatorium. So we provide those education programs. And on the right side, you see some brief history. We and now we have a President Kayama and Dean Ino for Faculty of Nursing, and Dean myself is a graduate school of nursing. Right, so here is summaries of bachelor's, master's, doctoral program. We have about 100 students in 1 year for bachelor's, and we have some students in master's and doctoral program. We have elective course for midwife. Currently, we have about 7 students can take this course for the 4th year students. And in the master's program, we have a certified nurse specialist course, which is elective for oncology, psychiatry, pediatric, and infection control. So this shows our 6 national centers. And so national centers provide policy-based advanced medical care, like oncology, cardiovascular, HIV/AIDS. And we have some hospitals around Tokyo. Most hospitals are in Tokyo and Chiba area. And we have a geriatrics and gerontology center in Nagoya, Aichi Prefecture, and one in Osaka. We have a cerebral and cardiovascular center. So those centers aim to provide improved quality of medical care in Japan, and also we provide international cooperation in medical services. So here are pictures of our skills laboratory. So beds and the staff station, and also Western and Japanese style rooms for home visit care. We have an intensive care unit simulator, and also a maternal and child health simulator. So students taking a blood pressure or doing a physical examination. Here is a simulated experience of older adults, and you may have this one at your college. So wear gloves and goggles, and to experience how getting old and how to assist those elderly. So here, a home care nursing simulation. So maternal child, and we have simulator, and students some experience to be a maternal experience. So we have okay. So before 1989, genetic nursing education in Japan was a part of adult health nursing. So in old days, so we didn't have a genetic nursing subject. So everything was taught under the adult health nursing. But now, because of the increasing number of elderly population, so genetic nursing became independent subject in 1989. And so, so here's some similar slide as the sensei showed, but so back in 1951, we have some specified regulation, which specified the number of hours to teach for public health nurse, midwife, and nurses, which is specified by the Ministry of Health. And again, so initially we had a fundamental general nursing, adult, pediatric maternity, but in 1980s, some programs started genetic nursing education, and the aging population was going a little bit, high and high. At that time, it was like 7 or 9%. And we also had a policy to focus on the genetic care. In 90s and 2000, so the aging population was more and more getting high. And in 1990, the Ministry of Health decided that the genetic nursing became independent subject. Yet some practice hours are combined in adult health nursing. But 1997, the genetic nursing subject became a totally independent subject, 4 credits in lecture, 4 credits in practice. In 2001, in the master's programs, genetic nursing specialist education has started. And we keep revising, and we have some amendments in our specified regulation for schools of nurses. So here's some history, and this shows the number of credits for nursing schools. We have fundamental subjects, basic scientific subjects, and in the understanding human and society. And we have some basic specialized study, human body and disease and health system. And we have many specialized nursing subjects. And the red letter shows genetic nursing, 4 credits for theory, and 4 or more credits for adult and genetic nursing practice. And the regulation says we can combine adult and genetic nursing and 4 or more credits, but our college NCNJ have 6 credits for adult health and 4 credits for genetic nursing. And as a total, 102 credits are taught in nursing subject. As a nursing college. So this plus shows the number of credits or above, and each college or each university can change depending on the situation or needs. But College of Nursing, we provide this number of credits. So the first year students learn about aging and health. So here are genetic nursing related subjects. Second year, we have an introduction to genetic nursing, and third year, we have more advanced theory and practice, more detailed and concrete subject. And we have practice. And the fourth year, we have further advanced subject for lecture and practice. And also we have adult health nursing, psychiatric mental, and community home care nursing from 2 to 4, second to fourth year. So in the first year student, we teach aging and health, teaching how, what's the definition of the aging and the senescence, just getting old, and also what kind of changes the older people experience, like physical appearance and function and psychosocial changes in those systems, and how these changes are impact on the health and the daily living of older adults. Second year, students learn more about older adults targeted nursing, definition of aging and population and developmental tasks, and the fundamentals of gerontic nursing, and how the social life changes among older population. And students also learn about diversity. Some older adults are very active, and some older adults need more assistance. And we also learn about human rights and ethical consideration among older adults. And students have some exercise for simulated experience of older adults and interviewing older adults to understand their life history. So they interview their grandparents. And also they do some simulated experience, like the picture we show previously. So when they wear these goggles or gloves, it is difficult to read small letters or push buttons, and they need assistance for walking. And if you have stairs, it's really dangerous. So the nurses really have to guide older persons not to fall from the stairs. So this is a good experience to simulate how getting old it's like, and also muscle weakness and the joint contracture, etc. And also narrowing visual field or hard of hearing. And it is a really good experience for the students who are wearing those gloves, and also for students who are assisting those elderly individuals. On the third year, students learn more about the characteristics of aging and health conditions, and how to assist elderly patients for daily living assistance, and how to provide care for older adults and family. And especially, we also focus on end of life stage, because older people, we really need to learn how to address the need of end of life issues. And also, we learn about medical welfare facilities for older adults, and students experience how to conduct nursing process and assessment, and setting care plan, and implementation and evaluation. So here are some pictures from on-campus training. So here are some young ladies, but she's trying to be tend to be a elderly, and here nurses, but how to assist older person to get up and transfer to wheelchair, or turn, or changing the body positions. Also, elderly people need assistance for mouth care, or cleaning the mouth, or how to handle the dentures. So, so under this COVID-19 era, we cannot, assist each other, but students use these models to practice, and students take these devices or materials to home, and watching in the mirror, and they do similar things, and how cleaning is difficult, and how to pay attention, and how it feels like to use these like sponges, etc. Okay, here are tables of our clinical practice. The objective is to understand older adults in the context of interprofessional collaboration with health, medical care, and welfare, to develop basic skills in nursing practice to aim at supporting health recovery, maintain, improve older adults' quality of life in daily living or in the end of life stage. We have 2 subjects, 2 credits, or 2 weeks for each. The first portion, students spends special nursing home or health service facility to understand how older individuals. And the second part, they go to National Center for Neurology and Psychiatry. And the second subject, students go to National Center for Global Health and Medicine. And they learn about how to understand health problem or older adults living in the community, like including home or nursing home, and their with families, and how to better support, and also how to support daily living who need hospitalization, and learn about what age-related changes impact older individuals, and also how the health problem may occur in older age. So students conduct nursing process, as I said, and develop care plan and implement and evaluate for those hospitalized in acute medical conditions. Plus, they need to understand family concerns and issues, and learn how to collaborate with interprofessional for discharge planning and continuity of care in the community, and how to use social services and social resources. So here are some pictures, as Sudo-sensei showed, some examples of nursing homes. Big baths or the food on the table, or some festivals, events. So students learn how older or senior citizens living in a long-term care facilities. So also students need to learn how to collaborate with doctors, dentists, physiotherapists, pharmacists, clinical clerks, and social workers, and because we have many disciplines or different professionals. So nurses are expected to be active in playing key role to collaborate or connect those interprofessional teams. And also sometimes nurses need to connect with like different fields, like specialists in law or engineer or urban design, etc. So this diagram shows, figure shows the number of hours changed 2020 or 21 due to a pandemic. Initially, we used a lot of online learning for lectures or seminars, skills laboratory. And last year, we increased the face-to-face on-campus hours. And the clinical practice, again, the same. Some hospitals allowed students to get in, but many hospitals had a limitation to conduct clinical practice. So we did a lot of online or face-to-face on-campus training. But last year, fortunately, we had about 50% of clinical practice. And this year is almost the same. But now we are experiencing COVID-19 pandemic again this November and December. So some subjects are changing to on-campus again, but it depends on the the situations. So last year and 2 years ago, we took a video at the long-term care facility, pre-recorded in stores online, and students watched those on-demand video. So instructors asked questions as if the students were visiting the long-term facility. So here's some pictures of the living rooms or beds, how to use motion sensors to keep the elderly safe. So here are living room or daily living room with the dining table and chairs, how older people spend time at the facility. Here, the shower room, the bathroom, the room designed for safety and privacy. They have, holding handrails and special shower chair. And how to prevent the infection? They have a good ventilation, and once the elderly come from home to get together in the daycare center, they wash hands upon arrival and change their masks. We used some real-time online clinical lectures. Students submit questions before the session, and questions are asked by the nursing home staff. The students ask some questions like, how is the life in the nursing home is like, or what are the precautions to talking with older people, or what are the family concerns or issues, or what are the safety issues, what are the roles of nurses. And also we ask the elderly to connect online, and older people who have a cognitive impairment, they still can talk, and with assistance with the staff, they can talk their experience. So we asked the older adults with mild dementia and obtained approval from older person and their proxy family, and answer the questions, and with assistance with the staff. So what's the fun activities at the nursing home, or what's the difference between your own house and the nursing home, and what are the daily activities? So with the help of the nursing home staff, students were able to communicate with older people online, and it was a real-time online. And sometimes we students had a on-campus training, like a face-to-face training, that here are some instructors put some wig and glasses to just pretend to be older person. And students paired up and took blood pressure or vital signs, or did some communication training with older patient. So here are another pictures. We have a changing room, shower room on campus, and the green with a man in a green pajama. He is actually an instructor, faculty, but he's trying to be a older person with a right hemiplegia, right side paralysis after stroke. Here, this lady is the instructor. She's acting as a preceptor or supervisor, and we have two students trying to assist older person to take shower. So here, under pandemic, we use our college to just do a clinical practice. But if the corona pandemic is stable and okay, the students go to real hospital, real clinical situation to do a clinical practice. But this is, under the pandemic situation, and it's like a face-to-face on-campus training to supplement clinical practice. Anyway, here's the last slide. So the genetic nursing in Japan has developed during the rapid aging phase, and the Japan is called as a super aged society. Now it's a aging population over 65 years old is about almost 30% now. Students study genetic theories and methods and exercise from first to third year, and advanced lectures, elective clinic practice in fourth year. The collaboration, coordination among genetic multi-professional and across acute hospital and long-term home community care is essential. Yes, and this is, I think this is the same principle applies in Indonesia and also in Japan and other countries. And lastly, interaction, communication with older adults and clinical or daily living setting is very important and encouraged. Even under this COVID-19 era, we need to take countermeasures to prevent infection, but we also need, young students and even ourselves need experience to communicate with older individuals day-to-day living, just to get our experience and improve our skills to communicate older people, because we need some skills to communicate older patients and older adults. Sometimes they have a hard of hearing, or sometimes they have a cognitive impairment, and sometimes they have a concerns and short of memory. So we need some skills and knowledge for genetic nursing. So anyway, okay, so here's our last slide. And thank you so much for your attention. And I terminate the sharing and I go back to the.
Thank you very much,
Okay,
Professor
thank you.
Watanuki, for the very interesting presentation. And then we can learn from your presentation how genetic education, in the undergraduate education for nursing, what is different between nursing education in Japan, and also we can learn what is the difference between what you have in your country and what we have in Indonesia. Well, thank you very much again. Okay, that we will already come to the discussion session. Actually, we have so many questions for the student. Thank you very much. We have so many questions for Professor Sudho and also for Professor Watanuki. But before we go to the what is written question in the chat room, I will invite some students, maybe one student, to ask question to Professor Sudho and one question to Professor Watanuki. Maybe Siva Eka, can you just directly ask your question to Professor Sudho? Can you do that? Thank you.
Yes, I can,
Yes,
but I can turn my camera. Is that okay? Sorry, I can turn on my camera because my signal is bad. It's raining here. So I would like to ask a question to Professor Sudho. Before that, let me introduce myself. I'm Siva. Thank you so much for your presentation. I'm very interested in home care services. Maybe I hope that I can build my own home care later. So I would like to ask that, can you explain further about how home care works in Japan? Does every patient immediately become a home care patient, or do we have to register ourselves to get services from nursing home and it is free, or we have to pay some fee That's my question. Thank you so much.
Professor Sudo?
Okay.
Okay. If
Thank
you-
you.
yeah.
Thank you, Sifa. Thank you for the question. I think I understand the how to organize and manage, and by the it is a government system. So it is a part of a government system. So the maybe the first of all you want to learn about the health system in Japan, but it is somehow difficult, somehow complicated to explain. But all of the medical treatment and the long-term care, it is covered by the health insurance system. So we have two types of this such kind of service care healthcare delivery system. So the one is a medical treatment. The long-term care insurance system is a part of the separate from the medical treatment. So including the long-term care. Long-term care means the nursing care or the support for the daily living, not focusing on the medical treatment. Some of the care is covered. Some of care, including the medical care, also covered by the medical insurance, long-term care insurance. But we have the two types. As I mentioned, you just understand the two types separately: medical care and the long-term care. So the majority, only few rich people can use their personal expenditure out of pocket for the long-term care. Long-term care,
Yeah.
but it is a very few. So the majority of Japanese, I mean the residents in Japan, including the foreigners, so can use the this medical long-term care insurance system. So if you pay by yourself, by your pocket, from your pocket, so it is too expensive. So that's why the government led to organize this system for the elderly, because Japan is a super aged society, and 1 of 4 is elderly already, more than 25%. So we need such kind of system. So that one is covered by, and also I want to explain about the delivery system. We have the public health insurance system, but the service care provider is private. More than 90% of something, the private hospital, also the long-term care facility, also it is the work for the private company. But we have another system of the medical, not only the medical one, the medical and welfare service fee, such is a separate organization we have. So that they decided how much this cost, and then we use the health insurance, and then the service care provider directly provide the care service, but we will pay only the 30% of something of the cost, and then others were covered by the organization. Yeah, that is somehow a complicated system. Did you get it? Sia?
Siva?
Siva, sorry.
Yes, I
Okay.
get it.
Okay.
Thank you so much
Yeah.
for explanation. I
Yeah.
think it's very complicated, but it's worth it to learn how home
If
care
I,
works.
yeah, okay. If I may, if I can, what is add a little bit in comparison to Indonesia,
Mhm.
I think Indonesia should learn from your healthcare system for elderly, which is integrated into the what is universal healthcare package in the country for the whole population, including older people, including the long-term care system for other people. But unfortunately, in Indonesia, even though we have been declared for since 2014 for the universal healthcare coverage, but for the long-term care system for older people, it does not cover. They only cover a small amount of money for primary healthcare, just regular primary healthcare. When they, for example, when older people stay or live in the long-term care, such as we call here, it's not a nursing home, but it's like we call it nursing home, but it's not. In fact, it's not. And then if they have like a cough or they have a kind of a disease, a diagnosis, the Puskesmas or primary care center can go to these nursing homes for providing medical care or small of nursing care, and or the elderly people go to the primary care. So this is only that, not like what you have in Japan, how the social service, how psychological service, how what is holistic care service for elder people are also funded by the healthcare system, but the healthcare insurance in the country by the government at least, yeah. But you also have the so it's quite complicated. Maybe we will try to learn to learn from your experience to make this very beneficial system for our elderly later. Thank you for Professor Sudo. You will have some other question, but please allow me to give the opportunity for Professor Watanuki. Maybe Haya Aisa, can you just directly ask your question to Professor Watanuki? Haya?
Yes,
Yeah, thank you.
First of all, let me introduce myself. My name is Haya. I would also like to thank Professor Watanuki for the one. Professor Watanuki. And I would also like to ask whether there are certain conditions in the elderly that will be difficult to simulate using the age simulator for the nursing practice. Maybe that's the question.
Sorry, because of the transmission. Could you
Okay.
say that again, please?
Okay, can you repeat your question, Haya? Thank you.
Yes. So the question was whether there are any other simulators other than the one that the professor told about, the one, the age simulator.
Okay.
And I would also like to ask whether there are certain conditions in the elderly that will be difficult to simulate using the age simulator for the nursing practice itself.
Oh, the simulator. Okay. Okay. The simulator I showed you was yes. So the simulator is basically, if you get older, sometimes you get, your visual field or the hearing ability may be affected. So those goggles or the earplugs may simulate hard of hearing or vision impairment. Or some elderly people, may experience numbness, difficulty to touch, or the sensation may be affected. So wear the gloves or the physical. If you have a problem in joint, or if you the elderly people get their back maybe kind of bent like this. So this is how to simulate the elderly. But as you said, yes, some conditions may not be simulated. Maybe for the memory loss or the elderly people with dementia, they may experience hallucination or delusion. So some company provide a VR experience video, like they interviewed dementia persons, how they experience the, like Alzheimer's disease, or the experience something like, if they are getting out of the car, they may feel as if it's like almost falling from the high rise building. So it's very scary. So because of the vision hallucination, so they some company provide those VR virtual reality video to simulate elderly people having dementia or things like that. So yeah, they are, so those VRs or digital technology is a very good method for the simulation. Yeah. 大宅のモデル。
そうですね。なんかああいう病院行かなくても、なんか学内で、あと階段とかもありますよね。なんかそもそも実習室にそういうのとかさっき出してましたけどもちろん。
そうですね。はい。So we have yes, we have some simulators like oops. Do we have a no. Yeah, let's see. So let's see, like this or like this or no, like this. Yes. So we have a simulator like this. Oh, no, like this. No? So yeah, we also have a stairs or steps or the it's. So this is an elderly simulation that yeah. So did I answer your question? Because yeah, this is only one example.
Yeah. I think what is the simulator is already integrated all in the simulator for I think it is very important for students to understand how to become an elderly person, an elderly patient, for example. So it will improve, it will enhance their attitude toward elderly. Yeah, it is very important for us. So the simulator is quite. I think we have also in Universitas Padjadjaran, ya, Ibu Citra, for this kind of simulator. Okay, thank you very much, Professor Watanuki. And Professor Sudo, we still, Professor Watanuki and Professor Sudo, we still have another 10 minutes to answer the question before we close all the session for today. Maybe Professor Sudo and also Professor Watanuki can choose which one questions in the box, in the chat box. You may answer based on your preference. Thank you very much. Maybe 2 questions for each.
So maybe I will answer about the first one. Yeah, from which one? Well, it's so many questions.
Yeah, maybe.
So
do you want me to just read it for you?
So, wait a moment. I have seen one. Oh,
Maybe from Putri, Hanipa.
eh, oh, yeah. I think somebody. Oh, yeah. Putri.
Putri, yes.
Putri.
It's about nursing homes for Alzheimer's or dementia.
Yeah, nursing home system. We don't have the especially only for the dementia person,
Mhm.
but the we have the level of the long-term care facility. So the severe condition of the dementia person, so the need more support, need more care. So that we have the like a intensive care for the dementia person, because it is somehow difficult to live alone in the community.
Mm.
So yeah, but they if they have this family support or some they can they can get the support from the others. So it is okay to stay at the home, but I have already mentioned the
Aged care
burden,
facility, yeah.
the burden for the family caregiver is huge.
Yeah.
Yeah, too high. So
Yeah.
it sometimes the healthy and very active a office worker, like a 50 years old man, earlier retired their job due to their care for their parents, his parents. So it means they reduce their salary, no work, but they have the burden for the care for the patient. I mean the parents. So that one is it is a big problem for the society also, because we need we need the workforce, but they should choose to quit their job. So that one is one problem. So they sometimes they go to the healthcare facility to take care for the such kind of elderly people. So then also we have that one is one institutional care, but we have also the dementia supporter, like a supporter, not the specialized expertise. They don't have expertise, some such nurses or social worker, no. Just the living in the community, but they understand the disease of the dementia, and just support. Not so the majority of them no need the huge support, just the small support accompanying something, it is okay. So it is the kind of the なんて言うんだろう、increasing the awareness to understand the elderly people. That one is also the government support that such kind of activity in the community. So to live safety and respectable full life in the community for the elderly. Yes.
Yeah, I think, yes, I am agree also, because taking care or caring for the elderly people without Alzheimer is already complicated, right? It's a complex system. So elderly people with Alzheimer or dementia, it's much more complex. So it has to be all integrated into the long care system, especially in the nursing home facility instead of home. Yeah. Very much, Professor Sudo. One more quick question for Professor Watanuki. If you still have some.
Let's see, what should I select? With the corona pandemic. Someone asked about the corona pandemic and challenges.
Yeah, all right. Yes, please.
Let's see. Well, yeah, I think the same situation is happening in Indonesia and Japan, but especially in the elderly facility, some elderly don't want to wear masks, or elderly people who are cognitively impaired, have dementia. They cannot understand about the coronavirus pandemic very well. So it is sometimes very hard to ask them to always wear mask or wash hands. But the nurses and care workers try to encourage elderly to wear mask or wash hands or keep a distance, and maybe trying to explain, well, there are some bad diseases around, so please make sure to wash hands and wear mask to keep you safe. Or sometimes it works, but sometimes it doesn't work. And we have many clusters in nursing homes, so it is very challenging for nursing homes and elderly facilities to keep safe and keep effective care environment. So we are still trying to work together, or even in the hospital too. So it is a challenge, and we need to share our experience and knowledge and wisdom to better handle this situation. Well, we encourage other individuals to keep vaccinated, and so that we have many specialist nurses who are specialists in infection control. So we developed some guidelines for manuals to keep like a green zone, yellow zone, red zones, and keep those basic infection control principles. But it sometimes works and sometimes doesn't work because of it's a pandemic situation. So yeah, so it is a very good question, and we are still keep working. And yeah.
Yeah, thank you very much. We have also the same problem here in Indonesia. Hopefully we'll get better sooner or later. Thank you very much, Professor Sudo and Professor Watanuki. We still have some very lots of questions here in the chat box, but maybe we can deliver it to you by email, and then if you have some time to answer the students' question, we will be very much appreciate for that.
Okay.
And
Sure.
yeah. If I may conclude a little bit, just more short conclusion about what we have for today for the two lectures. Yeah, that the management or the healthcare system for elderly is quite complex, but we can learn from what Japan experienced, that it has been since 2012, I think, if I'm not mistaken, that the long-term care for older people has already been integrated into the healthcare system in general, including the funding. That's what we have to learn from Japan experience, and also how the workforce, nursing workforce for elderly has been integrated and has been prepared in the undergraduate education. So later, maybe in the when the nursing student graduate, they have already competent, or at least ready for giving care for older people in the which is very the demand. The demand is very huge in Japan, also in Indonesia. Thank you very much for on behalf of the Dean of the Faculty of Nursing, Professor Kusman Ibrahim, he cannot attend. So on behalf of him, we're thankful to Professor Sudo and also Professor Watanaki for the very fruitful and important lecture for today. We hopefully in the next time we still can do this good cooperation with both of you. Thank you very much and good luck and good afternoon. Ibu Citra, do we have some certificate that we can share with the two professors?
Yes,
No?
but not.
We will send it by email?
Yes, we can send by email.
Okay.
Maybe we took the picture together.
Okay. Before we leave all, we just want to have a picture. Pak Gilang, can you do that?
Yes.
Yeah, sure.
Okay.
The student, maybe you can open the
Please
camera.
open the video, please. For the student. Okay. We're ongoing. Okay. I think we have one until 3 slides, probably. Okay. We're ongoing. Open your camera, please. Okay. I will count on 3. You ready? 1, 2, 3. Slide 1. Slide 2. 1, 2, 3. Slide 3. 1, 2, 3. Okay, I think it's only 3 slides. Thank you. Bu Hartia.
Thank you.
Okay. Thank you very much all. Have a good day today. Yeah, it's already nearly what is it? Have a good day. see you sometime and next time. Thank you. Bye bye.
See you next time.
Bye, Professor
so
Sudo and
much.
Watanuki.
Thank
Thank
you
you
so
very
much.
much.
Thank you.